thank you to the whole AHES team for putting this series together. And thank you for all of you for taking time out of your evening to listen to me talk about all the incredible work that we do at the CIC. So like Will said, I'm Dr. Caitlin Feiock, and I will be talking about clinical trials in pets, talking about pursuing additional pathways to care, and we'll go ahead and bust some myths along the way. So I'll start with just an overview, give us a little bit of a roadmap of where we're going today. I will give an introduction to the Clinical Investigation Center, or the CIC as it's called. We'll talk about what clinical trials are and also what they aren't. And then we'll highlight some recent successes, and then we'll do a brief overview of select active clinical trials that we currently have. So even though Will did such a great job of introducing me, I'll go ahead and give another brief introduction to myself and kind of why I'm the one talking to you about this today. So I am an assistant professor in the Veterinary Clinical Sciences Department at the College of Veterinary Medicine, and I am the research manager of the Clinical Investigation Center. I did my vet school here at the University of Minnesota. I graduated in 2020. Went on to do my rotating internship also at the U. And then like Will had said, I went to Madison for an oncology specialty internship. And then if you notice, I graduated in 2020, so peak COVID. So I got really burnt out with just kind of the zoo that was veterinary medicine during that time. So I ended up doing some in-home euthanasia for about 6 months. That allowed me to slow down and really kind of reconnect to clients and reconnect to why I do the things that I do. And then I was fortunate enough to join the CIC in August of 2022. And then just to kind of demonstrate that I am a real whole human outside of being a veterinarian as well. This is me with my 2 kids up in Duluth. And then this is my dog Roscoe, who was recovering from anesthesia and had no idea what planet he was on at the time that picture was taken, but it's one of my favorites of him. So we'll talk about what the CIC is. So the Clinical Investigation Center is an infrastructure within the College of Veterinary Medicine. It's been part of the college for almost 2 decades. And then the structure and the scope of work has changed since the time of its inception. But we are constantly growing and changing with eyes on the future for innovation within the field of veterinary and translational medicine. And so it is designed to support clinical research across a variety of specialties and disciplines. And this work may lead to new drugs, devices, procedures, and treatments for the benefit of animals and humans. And as we'll talk about a little bit later, some of our clinical trials are running parallel ones in people. So we are working kind of side by side with human doctors to advance outcomes for both those patient populations. And we support clinical research both within the college and across the university as a whole. Our team is a group of highly trained and skilled veterinary professionals, and we prioritize patient care and welfare above all else. And we really view clinical trials simply as a way to provide patients and clients with additional options and pathways to care. Our team consists of 5 certified veterinary technicians and 1 veterinary technician assistant. And all that they do is clinical care and clinical research. They have combined decades of experience, and they're some of the most skilled technicians I've ever had the pleasure to work with. And then there's me as a veterinarian and the research manager. And then we have Dr. Antonella Borgatti, who is an oncologist, who is our director. And I do like to just kind of point out here that, again, we are all veterinary professionals. And so I like to talk about a little bit about the veterinary oath that we take, because it really anchors our practice and kind of centers us in our mission. And so with that, I'll just read a little piece of it. It says, "I solemnly swear to use my scientific knowledge and skills for the benefit of society through the protection of animal health and welfare, and the advancement of medical knowledge, and I will practice my profession conscientiously with dignity and in keeping with the principles of veterinary medical ethics." And again, I like to just call that out because it really, really anchors us in our mission for providing exceptional patient care. And so our mission in the CIC is to be the premier veterinary research center for clinical trials in the United States. And we truly believe that clinical research is inseparable from providing state-of-the-art healthcare. We want to be the leaders in caring for our veterinary patients, and that really starts with doing this clinical research. Okay, so we're going to talk about specifics about clinical trials in a second, but I want to ask a question, and I know we're not face to face, so it's a little challenging to get a response, but just think to yourself, how many of you have a pet or know of a pet who is taking Apoquel or who has taken Apoquel in the past? And again, I can't see any of you, but I imagine that's probably the majority of the attendees here. And the reason that I bring this up is that our team was fundamental in managing the patients through all phases of the clinical trials that made FDA approval of Apoquel possible. And again, if you know of a dog or have a dog whose life was miserable before Apoquel, you know that this is really a life-changing medication that was able to come to market because of clinical trials. And so the fact is almost every single medication, device, intervention, and treatment is a direct result of a clinical trial. So this includes dose ranges, the frequency with which you give a medication, the treatment schedule with which you give that medication. Anything and everything is really the direct result of a clinical trial. All right, so I've said the phrase clinical trial probably dozens of times already. So let's give you a definition. So according to the NIH, a clinical trial is a research study in which one or more subjects are prospectively, meaning ahead of time, assigned to one or more interventions or treatment groups. These groups may include a placebo or other control. And this is done to evaluate the effects of those interventions on health-related biomedical or behavioral outcomes. So now we have established what a clinical trial is. So now we're going to talk a lot about what clinical trials are not, because there are a lot of misconceptions about what clinical trials are. I talk about what I do with people all the time, and the kind of variety of responses to what they think that is kind of astounding. So we'll talk about what they aren't. So to start with, clinical trials are not miracle cures. So there's a phenomenon called the therapeutic misconception that's been described in human clinical trials. And this misconception persists even when patients demonstrate an understanding of all of the aspects of a clinical trial. And we'll talk about that in just a second. So this is defined as the phenomenon where, again, despite explanation, patients believe that the study protocols are designed to benefit them directly rather than to test or compare treatment methods. And so this persists even when patients demonstrate an understanding of randomization, and that is the process by which participants in clinical trials are assigned by chance to separate groups that are given different treatments or interventions. And neither the researcher nor the participant chooses which treatment or intervention the participant will receive. This also persists even when they demonstrate an understanding of what a double-blinded study is. And that means that neither the participant nor the researcher knows which treatment or intervention participants are receiving until the trial is over. And it also still persists in the face of demonstration of knowledge of placebos. And just for those that are not familiar, a placebo is an inactive substance or other intervention that looks the same as and is given the same way as an active drug or treatment being tested. And so these patients frequently persist in a belief that they're purposely going to receive the treatment that most likely benefits them directly. So this is in the context of human clinical trials. But I will say anecdotally, just from some of the clients that I have been able to interact with, I will say that this also persists in veterinary medicine. So we spend a lot of time educating our potential clients that would like to enroll their pet in a clinical trial, kind of what to expect. And you know, I like to be an optimist, but I'm also a realist. And so I know that we're all hoping for miracles. Oftentimes, clients find themselves in the situation where they are enrolling their pet in a clinical trial because they feel like they have no other option and they are hoping for a miracle. And so we really, really talk through this, that's not what we should expect. It's what we hope for, but not what we should expect. Secondly, clinical trials are not unregulated experimental treatments. So, you know, you hear the phrase kind of using patients as guinea pigs, and that couldn't be further from the truth. So veterinary clinical trials are highly regulated and have multiple levels of oversight. Patient care is provided as would be considered standard, and oftentimes in clinical trials, the treatment options offered may be more extensive. So what we offer in a lot of trials is the standard of care for whatever disease process that pet may have, and then plus something additional that we think may have an added benefit. And then in some cases, clients are offered access to new treatments before they're available to the public. And there is evidence to support safety and efficacy of interventions in preclinical models prior to use in client-owned patients. And then the owners of animals in veterinary clinical trials are well informed prior to participation. This includes the risks and benefits. And most clients report having a very positive experience. And many owners report feeling like their pets received extra attention and had more closely attended veterinary care when compared to the average patient. And I will say we do see that, again, it's anecdotal, but quite frequently. And that's just kind of simply because our caseload on any given day tends to be a lot lower than kind of your specialty service. And so we are able to give that one-on-one directed attention to that patient for the entirety of their visit, which is something that is not available to a lot of patients just simply because of the caseload for the specialty service that they may have seen otherwise. And then also, clinical trials are not inherently dangerous. So again, like I said, veterinary clinical trials are highly regulated and have multiple levels of oversight. There are many safety measures in place for patients enrolled in a clinical trial. So this includes careful study design by veterinarians, and that's one of my major roles in the CIC actually. As a veterinarian, anytime anyone approaches us with a potential clinical trial, my first job is to look at their protocol and make sure that it not only seems feasible for our patients and our clients, but also that it is something that we should expect to be at the very least safe. And so then also that includes review and oversight by our institutional review boards. And for us at the university, the ones that we most commonly interact with for every single clinical trial that we put on, the IACUC, or the Institutional Animal Care and Use Committee, is required to review every single protocol. And the required members of the IACUC are a veterinarian, a practicing scientist, and then a non-scientist. So that's a member with expertise in a non-scientific field. And then also a public member who represents the community's interest in animal care and use. And so that group of people reviews every protocol for every clinical trial. And then the other one that we interact with commonly is the IBC, or the Institutional Biosafety Committee. And this committee is responsible for the review of university research that involves recombinant or synthetic nucleic acid molecules, so RNA or DNA, any potentially hazardous infectious agents, and then any potentially hazardous biologically derived toxins. And this is really important as we start to kind of move the some, especially in oncology, some of the immunotherapy trials are using kind of these viruses or other type of infectious agents and modifying them so that they actually go after cancer cells. And the IBC is really important in making sure that not only do we think that that's safe for the people administering those treatments, but also safe for the pets that are receiving them. And then also safe for the clients that are taking those pets home, making sure that we have evidence to say that nothing dangerous is going to be shed in things like saliva or urine or feces. And then we also do we have strict scrutiny with careful monitoring of our safety data and adverse events. So we document every single adverse event, even if we think that potentially it's not even related to the intervention that they received as part of the clinical trial, we document that. And then we also have kind of strict stopping points that can be kind of trial specific, but we do kind of reserve the right to stop if we think that the risks are outweighing the benefits that we're seeing once it's in practice. And then patients enrolled in clinical trials also typically receive monitoring that is beyond the standard of care for their disease. This includes more frequent visits. Often clinical trials involve a lot of visits back with our study team. And so that means that we get to see this patient more frequently than they would be seen kind of again on a given kind of recheck schedule for their standard of care. And then we also monitor things like blood and imaging more frequently than they probably would get, again, with a standard of care. And then this monitoring is usually at no cost to the client. So those extra visits, that extra blood work, extra x-rays, abdominal ultrasounds, things like that are all usually covered by the clinical trial itself. And so again, you get this extra monitoring without any additional financial burden. Clinical trials also are not free care for anyone who wants it. So each clinical trial has specific enrollment criteria, and this guides which patients are eligible for participation. So these criteria can include things like age, health status, breed, any sort of medications that are being taken by that patient prior to them enrolling in the clinical trial. And that eligibility criteria, while sometimes it seems really strict, what it does is it helps us to protect patients. And then it also helps us to understand if the effects that are seen are a result of the trial intervention or potentially something else. So while it's not free care for anyone who wants it, most of our clinical trials are fully funded or very robustly funded. So that means, again, that these pets receive this care, and it's often at no or relatively minimal cost to the client. Another thing that clinical trials are not is placebo treatments only. So placebos may be used, but they're not used as the only treatment for serious diseases where there's already a known effective therapy. And if placebos are used, the client is informed as part of the consenting process prior to the enrollment of our pet, or prior to the enrollment of the pet. And then many clinical trials are comparing promising new treatments to a standard of care treatment, or the trial will give two medications together versus each given separately to see if we get an additional effect when they're combined. And the client reserves the right to discontinue participation and return to standard of care or discontinue any treatment at any time and for any reason during the course of the clinical trial. And, I just talked about the consent process, and we kind of talk about it as if it's this one moment in time, but really it's an ongoing conversation throughout the entirety of the clinical trial while that pet is enrolled. We have the process at the beginning where we go through the whole consent form that should lay out the risks and benefits or any expected risks. And then, we have you sign it, we answer any questions. But really, that's not the end of that process. It's ongoing. And like I said, you can choose to discontinue at any time, and we'll often help you get a referral to the specialty care service or help you get set up with any sort of palliative options if you're choosing kind of to discontinue care altogether. The other thing that clinical trials are not is care only available by referral. We love speaking to clients who contact us to seek more information for care for their pets. Clients can and often do. I would say I get multiple emails, voicemails every week contacting me directly to seek more information about care options for their pets. So if you do that, we may contact you or your primary care veterinarian to request medical records if you have expressed interest in enrolling your pet. And this allows us to gather more information to determine if a clinical trial is a suitable option for you. And even if after all of that, we determine that it's really not a good fit, we still really love having those conversations, and we're there to have them kind of whenever. So that was a lot of information. So just to recap, what clinical trials are not. So they're not miracle cures. They're not these unregulated experimental treatments. They're not inherently dangerous. They're not just free care for anybody who wants it. They're not placebo treatments only, and they are not available only via referral. You can self-refer to us, and we'll make sure we put you through the right process again to get you in to see us if it's a good fit. Okay, so now we'll talk about some success stories because those are the most fun. So first we'll talk about Zelda. It's an 8-year-old female spayed greyhound. Zelda is not actually her name. This is not actually Zelda, but it's a cute dog. And she was enrolled in the Vigor clinical trial. And so this clinical trial was for dogs with non-metastatic osteosarcoma. And so for those of you who are unfamiliar with osteosarcoma, what that is a type of cancer that most commonly affects the long bones of large and giant breed dogs. However, any size of dog and any bone can be affected. And osteosarcoma causes these lytic or kind of masses that eat away the bone, and or at the same time these proliferative lesions of the bone, and it's very, very painful. Most commonly it spreads to the lungs, and it is also a cancer that we consider metastatic at diagnosis. So that means even if we don't see evidence of cancer spread on an X-ray or a CT at the time we find that primary tumor, we still assume it's there. And so standard of care for osteosarcoma is an amputation of the affected leg, and then chemotherapy using the carboplatin chemotherapy agent. And the prognosis for patients who receive the amputation and chemotherapy is usually about 9 to 12 months. And so the investigators for this clinical trial were trying to see if we could do better than that. So enrolled patients receive this oncolytic virotherapy. So that utilizes a modified virus that then gets preferentially taken up into the tumor cells, killing them. And then it also causes an immune response, which triggers the immune system to attack the tumor cells as well. So they received that, and then they also received the standard of care, which again is that amputation and chemotherapy. So Zelda, so standard of care treatment is quite expensive. I think here at the university with the amputation and chemotherapy protocol, you're looking around $10,000 to $12,000. And so Zelda's owner would have elected palliative care due to financial limitations. And the prognosis with palliative care, which usually consists of mostly managing pain, would have been about 2 months. And but the Vigor clinical trial covered up to $8,600 in care. So at the time that this trial was active, that included all of the trial procedures and then most of the chemotherapy costs. So again, we're thinking about Zelda's owner, who was would have chosen that palliative care due to financial limitations, looking at a prognosis of about 2 months. And Zelda, we actually lost her to follow-up because she lived so long that we stopped asking about her. But she lived at least 5 years from the time of her diagnosis. And at our last follow-up call, which again was 5 years after she got diagnosed with osteosarcoma, she had no evidence of metastatic disease, and she had excellent quality of life, which is just fantastic for her. And really, she just knocked it out of the park. The next success story I want to highlight is Piggy, a 7-year-old female spayed French bulldog. Again, Piggy's not actually her name. That's not Piggy, even though it's a very cute Frenchie. And she was enrolled in the sonodynamic therapy, or SDT, brain tumor clinical trial. So this clinical trial is for French bulldogs with high-grade glioma. And high-grade glioma, again, just a little bit of background for this disease. It's one of the most common primary brain tumors in both people and dogs. In human patients, the standard of care treatment is very intense, and it often involves, it involves surgery, radiation therapy, and chemotherapy. So even with this super aggressive approach, the tumors usually come back within months, and the median survival time for people is only about 14 to 15 months. In dogs, there's no true standard of care, but the median survival time with palliative care, which is usually medications to control seizures, or surgical removal of the tumor alone, is about 2 months. So in this clinical trial, the patients enrolled received an initial sonodynamic therapy treatment. They got surgery to remove their tumor, and then they had repeated sonodynamic therapy treatments every 4 to 6 weeks. And what the sonodynamic therapy treatment is that dogs receive this medication called 5-ALA. That medication, they take it by mouth. It then accumulates within the tumor tissue. And then we use this kind of like helmet that focuses ultrasound waves at the tumor. And that activates that 5-ALA medication with those ultrasound waves. The activated 5-ALA then kills only the cancer cells, and it has minimal impact on the normal tissues around it. So again, when we're thinking about kind of these gliomas in our dogs, we're looking about like 2 months with just surgery alone. With the SDT clinical trial, Piggy survived 19 months and she had a great quality of life. She was just wonderful. Every time she came in, she's, wiggling around like a typical Frenchie. She did have surgical revisions during the clinical trial, but again, her quality of life was excellent. She continued to receive the treatments until she ultimately did succumb to her disease, but again, with about over a year, almost 2 years. So next we're going to talk about Charlie. He was a 13-year-old male neutered mixed breed dog. So this actually is Charlie. This is actually Charlie's name, and I'll talk about why I'm not protecting his identity in a second. But he was enrolled in our Ethos Push clinical trial. So what this clinical trial is for dogs with non-metastatic hemangiosarcoma of the spleen. So that means that tumor is just confined to the spleen. It has not spread anywhere that we can see. So just for some background on this disease, canine splenic hemangiosarcoma is an aggressive cancer and it has really limited treatment options available. Oftentimes, the way these dogs come to us is on an emergency basis, and that's due to spontaneous internal bleeding, and that causes sudden weakness and or collapse. And for dogs with splenic hemangiosarcoma, the standard of care is surgery to remove the spleen, or a splenectomy is what that's called, and then chemotherapy with doxorubicin. The median survival time for dogs with a surgery or splenectomy alone is 1 to 3 months. And then the median survival time for splenectomy plus that doxorubicin chemotherapy is about 4 to 9 months. So again, it's really aggressive. We have kind of very minimal treatment options, and the outcomes with those treatment options are not excellent. So all dogs that are enrolled in this clinical trial receive a splenectomy as part of their enrollment. We then submit the tumor tissue to make sure that it is hemangiosarcoma. There are other kind of masses, other causes of masses on the spleen that also can cause bleeding of the spleen. So we confirm that it's hemangiosarcoma. Once we have that, dogs are then randomized into one of 4 treatment groups. Those treatment groups are either, so the first one is doxorubicin alone. And the reason that this is the chemotherapy of choice is that it is one of our most broad spectrum chemotherapeutic agents. And it's also used in humans for unresectable or tumors that can't be taken out by surgery, or metastatic angiosarcoma. And angiosarcoma has similar biology to hemangiosarcoma in the dog. The second group is doxorubicin and plus oral rapamycin. So again, this is where our patients are getting a standard of care plus something else. Rapamycin was chosen because it inhibits an important cellular pathway in hemangiosarcoma cells, and that's linked to dysfunctional metabolism of those cancer cells, which causes them to not be able to replicate as well and die. The third group is doxorubicin and oral sorafenib. So sorafenib has been shown to block pathways that are important for new blood vessel formation, which we believe likely plays a large role in the progression of hemangiosarcoma. And then finally, the last group is an oral medication called paclitaxel. So the reason that this was chosen as a treatment option in this clinical trial is that it's actually the first line therapeutic for people who are diagnosed with angiosarcoma. So Charlie got doxorubicin and oral rapamycin. And Charlie actually made it 14 months with an excellent quality of life and no evidence of metastatic disease. At his recheck at 14 months, he did have a new metastatic lesion in his liver. But again, he was feeling good and he did awesome through the clinical trial. So the reason that I'm not protecting Charlie's identity is he was actually featured in one of our profile stories. I put the link here. I'll make sure that it is part of what gets sent out to you in the follow-up email. But Charlie's family was so gracious to share his story and their experience, and it just was really amazing to be trusted by them, and I think it's a good read. for any of you who are curious kind of what their experience was. Okay, so now we're going to highlight some of our current clinical trials now that we've talked about some past successes. So as was said in the introduction, we're currently supporting over 40 clinical trials, and that's across a variety of disciplines. I'm not going to go through them all. It would take multiple of these 1 hour kind of talks to go through the specifics of them all, but we can highlight a few of them. So in the first discipline is oncology. And so right now we are currently enrolling dogs with the following tumor types. So dogs with osteosarcoma, and we have options for dogs with both metastatic and non-metastatic osteosarcoma. So dogs that have just a primary bone tumor or dogs that have a bone tumor plus evidence that it has spread. Dogs with hemangiosarcoma, non-metastatic at this point is the only option we have for a clinical trial. Dogs with melanoma, we have multiple options for dogs with melanoma, including ones that have spread to the regional lymph nodes, or ones that have not. We also have clinical trials available for dogs with sarcoma. These though have to be non-metastatic, so just a single tumor. And then also for dogs with lymphoma, and these dogs can have both naive lymphoma, meaning, they're just diagnosed, they haven't been treated with anything, or it can have been treated and they have since relapsed, or it could have not responded to the treatment, so it's considered refractory. We have clinical trials available for those dogs. We also are so lucky to partner with the Canine Brain Tumor Program. So the Canine Brain Tumor Program, or the CBTP, is the most recognized canine brain tumor clinical trial program in the country. It offers a number of clinical trials that not only provide hope for pet dogs with brain tumors, but also provides crucial information for treating the same brain tumors in people. We're actively recruiting for several clinical trials. And so the ask is that if you know anyone or you yourself have a dog that has been diagnosed with a brain tumor, please reach out or encourage your friends to reach out. A little bit later, I have the contact information for them, and I'll also make sure that that gets sent to you in the follow-up email. We also have some clinical trials, or a clinical trial right now in the dermatology specialty. And I tried really hard not to be stereotypical with the pictures of the dogs that I chose, but I couldn't help it with this adorable pitty and its terrible, I'm assuming, skin because it is a pitty. And so we're currently enrolling dogs with superficial pyodermas. So this clinical trial investigates the efficacy and safety of a topical product containing a molecule called ceraginin, and that's for superficial bacterial skin infections. The reason that this is important is that multi-drug resistant bacterial skin infections are increasing in frequency, and that's due to the non-judicious and frequent use of systemic antibiotic therapy to treat superficial pyoderma. And so this is helping us, one, not only help our pets with this condition get some relief, but also potentially offering another option so that we can be better stewards of our antibiotics and stop driving the antibiotic resistant bacterial infections. And then I know I've talked a ton about dogs. We also do work with cats though. And the one I want to highlight here is for pain management. So we are currently enrolling cats with arthritis. So this clinical trial evaluates whether or not a new painkiller is able to provide pain relief from arthritis. The reason that this is important is that recognizing and managing pain in our patients is essential for ensuring their quality of life. And what we do know is that pain from osteoarthritis is reported to affect about a quarter of dogs that are over a year old and up to half of our cats. And any of the cat owners know that cats are really, really good at hiding kind of that joint pain. And so if you or anyone you know has a cat that either has osteoarthritis or you think may have osteoarthritis, we may have some options for you to help them find some relief. All right, so now that we've talked about some successes and we've highlighted some of the things that are going on right now, some of you may be asking yourself, where can I find some more information? So I want to start out with just again highlighting kind of these profile stories, and I put the link here that go directly to the ones that pertain to research. That's where you'll find stories about the work that we're doing. And again, I'll make sure that this link goes out. But I think these are really a cool way to kind of get the first line information, because oftentimes what we do when we work with the writers of these stories is we really want to make sure that we're connecting actual patients and their families, and allowing them to tell their story of their experience while also highlighting the awesome work and science that goes into these clinical trials. And so I'll just kind of talk about um what what the ones I chose to highlight here are. So in the top left, with our kitty, is that clinical trial for the cats with osteoarthritis that I talked about earlier. In the top right is for our burst wave lithotripsy. So that's using ultrasound to break up kidney stones and help those patients find some relief. In the bottom left is one of our brain tumor clinical trial patients, Violet. And she and her family were just astounding, and they were so gracious to share her story and the background of how they found their way to us. And she just was amazing to work with. And then in the bottom right is our boys, Hank and Finn, talking about one of our melanoma clinical trials and kind of their experiences, and two different dogs and two different families with two different motivations for participating, but ultimately kind of looking for the same outcomes, and kind of talks about their journey there. So we try to highlight specific patients or ongoing clinical trials in each edition of this series. And so I recommend you kind of check those out when they come out. Another place that you can find information about what's going on with us is actually at our own website. So I have a QR code here and then the Z link as well. And again, I'll make sure that this gets sent. But it brings you to our landing page, which you can see here, and this will tell you our ongoing clinical trials. They're sorted by category. So when you click this drop down, it gives you a list of all of the specialties. So things like oncology, internal medicine, things like that. And then you can also filter by species. I believe at this point it has dogs, cats, and horses are the options. And then each of these, there's a link for the actual study page itself. That will give you way more information than what is just in this tiny little synopsis here. And then for each of those two at the top of that page for the specific study, there is a little button that says, I'm interested, and you can give us a little bit more information about what you're looking for. And then we can follow up with you to, again, see if it's a good fit for you and your pet. And then also the AVMA, or the American Veterinary Medical Association, has a veterinary clinical trials registry. So this helps animal owners and veterinarians find veterinary clinical studies in the United States and Canada. And so it brings you to this landing page where you can filter by species, and then you can also filter by kind of the primary field or disease that you are looking for. Oftentimes, if you contact us and ask if we have something that we can help your pet with, and the answer is no, I often find myself looking at this page just to see if we can point you somewhere else to get you some help. But that is available to the public to look through as well. You don't need to be a veterinarian to access that. And then finally, you can always talk to us directly. So for brain tumor specific questions, they have their own email address. So again, that's the Canine Brain Tumor Program, k9btp@umn.edu. And then for any other questions, you can always email the CIC directly at for veterinary CIC@umn.edu. We'll try to make sure that that gets forwarded along to the appropriate people to answer whatever questions you may have. You're not bothering us. That's part of our job, is to help educate you and let you know what we have available. So please, please, please feel free to contact us. Um, so with that, I'm pretty much done with the main content, but what I hope that you took home from this talk is that clinical trials are not unregulated experiments on animals, but instead are highly regulated and run by caring and highly skilled veterinary professionals. Clinical trials represent additional pathways to care for patients and clients alike. So they're something that we can offer that other specialty referral hospitals cannot. And then also that we love talking to pet owners about whether or not a clinical trial is a good fit. And so please, please, please feel free to contact us whenever to ask your questions. And I can't leave here without saying thank you. I know that I'm the one that's giving this presentation, but the work could not get done without our incredible team. So this is our whole team at one of our most recent holiday parties, and our technicians are really kind of the heart and soul of the CIC, and that's how we get anything done. And I also want to just say thank you to our research office support team. They make the kind of gears turn seamlessly. And so I just can't thank them enough as well. I also want to thank all of our collaborators. That includes our faculty members within the college who make this important work possible. And then really, really thank you to every single family that has trusted us with the care of their pet. We know that it's a big decision and it can be a really difficult decision and it involves a lot of trust to have us work with you. And so we just can't thank them enough for allowing us to care for their pet and being so generous with their time and their hearts, really. And then also, we want to say thank you to all of our generous donors who see the importance of this work and help to make sure that it is possible. And with that, I will take any questions.
Thank you so much, Caitlin. Thanks for that great presentation. So we'll start with the pre-submitted questions first that we got from guests who registered. This one asks, how challenging is it to remain unbiased and objective during a clinical trial?
That's a great question. I will say that we have a lot of kind of stopgaps to make sure that we can remain unbiased and objective. So for some clinical trials, that means being blinded again. So the veterinarian who's working with that patient or the technician who's working with that patient, we don't actually know which intervention they're receiving. And then for those that are not blinded necessarily, we make sure that we're gaining a lot of information from various sources to make sure that we're not kind of driving the expected outcome or the desired outcome, I should say. So we ask owners, we give owners surveys about how they think that their pet is doing at home. We use things like our physical exam results, our blood work results, all those things to try to use data to remain as objective as possible. So I will say also we do a lot of training to keep ourselves being as objective as possible. So I don't think it's necessarily difficult, but it is a kind of frame shift you have to do when you do this type of work.
Great, thank you. This one is a logistical question. How long does a typical trial usually last?
That's a great question. And the kind of unfortunate answer is that it depends. So some of our clinical trials, are kind of expected to do follow-up visits for maybe 2 weeks, 4 weeks, 8 weeks. Some of them are a one-time blood draw. Others, the hope is that we can follow the patients out to a year or more. All of that is talked about in the consent process. You usually get a pretty abbreviated schedule of events for what's expected if your patient kind of goes through the whole trial process. But again, at any time you are able to say this actually isn't working for us anymore, whether it's for scheduling or you're not satisfied or you just don't think that you're getting kind of what you're expecting, you can always choose to end it early as well.
Great, thank you. This person has a question about risks and asking if you could help us understand any risks associated with participating in a trial.
Yeah, so I think kind of the overall big generic risk, and I'll put that in kind of soft air quotes, is that oftentimes the purpose of the clinical trial, right, is to see if we can get a new outcome for a specific disease, right? So the risk is sometimes we don't know what we're going to get. And so some of these clinical trials, even though we have, again, expectations uh, that there's evidence to support that we may do better than kind of the historic outcomes for our standard of care treatments, sometimes that doesn't happen. So that's kind of the overall kind of like broad risk. I will say then kind of the more nuanced answer to that question is each individual clinical trial has various levels of risks. But that also is to say that nothing that we do in medicine or really in life is risk-free completely. Like you even having a headache and taking an ibuprofen, like that comes with a risk, whether it's, small or not. And so we talk about those risks in great detail as part of the consent process. And then if at any time you are concerned about what's happening with your patient kind of at home, we also talk about those at every visit to try to mitigate those risks the best that we can.
So thank you. This one talks about ethical considerations when running a trial. This person asks, does the College of Veterinary Medicine have anything like an internal investigation review board, which you did touch on? And they're wondering if you could talk more about, is it comprised of mostly veterinarians? What is everyone's role on the board? What defines an ethical trial?
Yeah, so there are kind of multiple considerations that we make when we talk about ethics. And so, right, and on the human side, that IRB or the Institutional Review Board is very similar to the IACUC that I mentioned. So that's the Institutional Animal Care and Use Committee. And so I talked about before that it is required by law. So that is actually an organization that is overseen kind of at the higher level by the USDA. And so it is required to have those at 4 members at minimum. Oftentimes they have more than just 4 members, especially at a university this large. But the members have to fit into one of those 4 categories. So again, that's a veterinarian, and that veterinarian has to have experience with clinical trials and or lab animal medicine and care. A practicing scientist, so not someone who, was practicing in the 1940s, but someone who's actively practicing science now and is up to date on kind of the best practices. And then someone who has specialty somewhere else. So that could be a lawyer. I think I saw an example when I was doing some reading. It could be someone, a member of like the clergy. They just have to have some sort of expertise that's outside of the world of science. And then a general member of the public. So someone who really kind of represents kind of your everyday person who's not immersed in this world. And that really helps to provide multiple perspectives for what is being asked to be done in these clinical trials. So that's kind of the oversight review board. And then on top of that, especially in our team and with the people that we work with, internally we're all veterinarians, and so our overall kind of goal is to promote the health of these patients, and so we wouldn't do anything that we would consider kind of unethical as far as just a general practicing veterinarian. And then that's really my role, is to talk to if oftentimes we're approached by some pharmaceutical companies or medical device companies, things like that, that have devices or drugs that they think are promising. But oftentimes they're not well versed in veterinary medicine. And so that's my job, is to educate them in what we would consider ethical, expected, like safety precautions, things like that. So there's a lot of thought that goes into it prior to even getting started. And I would say oftentimes there's at least 6 months to a year of work going into getting these trials off the ground. Even after the grant has been funded or proposed, we do a lot of work to make sure that we have expectations of safety and maintaining those ethical standards.
Great, thanks. To further that theme, this person is asking about what are your sources of funding, either for the CIC program in general or for any individual trial. Is that University of Minnesota? How does industry or pharmaceutical companies support the program, any government support or private support?
Yeah, that's a great question. And honestly, the funding sources are variable. So we get funding from a pretty diverse group of sponsors. And so some of our clinical trials are sponsored by governmental agencies. So like the NIH or the Department of Defense, even we have a couple of trials that are funded by those entities. We then do have some projects that are funded by internal university funds. Those are the investigators will write a proposal and it works the same as a grant funding. It's just that it's coming from the university. We also get funding from foundations, so things like the Morris Animal Foundation, things like the Wynn Feline Foundation. Oftentimes they have specific questions and health concerns that they're really interested in trying to, again, do better by our patients, and so they will provide funding for clinical trials. And then we do partner with outside kind of private entities, and those range from these big corporations to small startups, and so we kind of get funding from everywhere, but again, that through line is we're making sure that what we're doing has the patient kind of centered in it, and so we don't just take money from anyone who wants to give it to us. We do scrutinize where that comes from as well, and making sure that we're doing right by our patients and their families.
Thank you. This one is another logistical question. When would a person enrolled in a trial with their animal decide to stop being in a trial due to an unexpected outcome, good or negative?
Yeah, so that's a great question. So, again, the client really drives that bus for us. And so it's really if they're feeling uncomfortable or feeling like they want to stop. And again, sometimes it's scheduling that when they first say, yes, I want to participate, they're like, all of these visits I can accommodate. And then it gets to be like life happens and it gets to be really overwhelming and they just can't make the follow-ups. And so that's a perfectly reasonable reason to not continue. Um, for I will say the adverse events, so if we're seeing negative outcomes, sometimes that is patient specific, right? So that patient just for whatever reason isn't tolerating what we have asked of them. And so then we have that conversation about like, again, are the risks outweighing the rewards at this point? If it's not just patient specific, sometimes we decide as a team that we don't feel comfortable enrolling more patients simply because we are seeing a higher level of more serious adverse events than we were expecting when we started. And so we'll make the decision to stop. Um, and then, but otherwise, you are not, once you sign the consent form, you're not locked into a contract with us. Like you can decide to stop at any point, and it doesn't damage your relationship with the university. It doesn't damage your relationship with a veterinary medical center. We're happy to help you find what option works better for you. Again, because we have a patient-centered focus on our team.
Awesome, thanks. We have time for about one or two more questions. You mentioned that the participation in a trial can often be fully covered. The costs can be covered by other sources of funding for people who enroll their animal. In cases where the participation is not fully covered, what types of expenses might there be?
Yeah, that's another one where the answer is kind of the annoying it depends. And so when we know at the beginning whether or not we can offer you the kind of fully funded, meaning that the visits and the treatments and everything that are part of the trial are going to be at no expense to you. Or if there's a cap, right? So oftentimes we'll say we'll cover up to a specific amount of money. And then we will have kind of an expectation of how much it's going to cost you after, right? We reach that cap. We also have the discussion, sometimes there are things that are covered, but like if let's say your patient is coming to see me for a cancer clinical trial, and when I examine them and I run their urinalysis, they have a urinary tract infection, right? Like, I'm not going to say, oops, too bad, we'll leave that untreated. We'll talk about what the treatment for that entails. And then oftentimes that would be like the medication for that would be at your expense. But again, we have that conversation too about whether or not it makes more sense for you to go see your primary vet for that treatment, or if you're comfortable with us doing it at the university. So it's we try to be really transparent. I know that finances, especially in veterinary medicine, are serious. Like, that's not a joke, and veterinary care is very expensive. And so we try to be really, really upfront with, if we know we're not gonna be able to cover the entirety of the costs, what that cost burden would be to you after we've reached kind of what we're able to compensate.
Great, thank you. We're at the end of our time, so we have one more question. Is there a local need for more veterinarians? And what percentage of graduates go on to pursue clinical work like this?
Oh, that's a that's a whole other talk in and of itself, I think. So what I can say is that COVID, for sure changed the landscape of veterinary medicine, I think, indefinitely. And so I do think that there is a shortage of veterinarians. I think people feel that, when they try to get appointments for their pets. I think it has been made a little bit easier, but definitely not where it was kind of pre-COVID. And then I don't have the data actually for how many veterinarians do go on to kind of pursue this type of work specifically. Um, it's a small percentage, I believe, of all the veterinarians that are out there. But I think that's also probably partly because people may not know the opportunities, like this exist. And I think kind of the more that we can kind of communicate with both the public and other veterinarians, the more that we can get them involved, even in, small ways. They don't have to head up the trial, but maybe they, could help collect data or enroll patients, things like that.
Thanks.